We've been really lucky so far. We haven't had a ton of snow. We've had a little bit, but shoveling snow is something most people dread, and it can also be one of the main culprits of wintertime heart attacks. Not something you might think about, but you should. So this morning, we are going to be talking about keeping your heart healthy during these frigid winter months, and joining me is Dr. Shola Ezeokoli. Ezeokoli, thank you. I should have asked you before. I know I can say it. Shola Ezeokoli. Thank you so much for coming in this morning. We have been fortunate, not a ton of snow.
Fingers crossed.
Right, but it can be really a bad thing for a lot of people. Are some people more susceptible than others?
Yes, actually, in the winter months, to be honest, most heart diseases are commoner during the winter months, actually. And that's due to a number of factors. You know, we don't eat as clean as we do during the summer. We're not as active. Our vitamin D levels go down. But a problem that, unfortunately, we see a lot of, and actually, last year, I know of 3 people that were affected by this. Unfortunately, they're deceased. They get heart attacks while shoveling snow. And
it's the amount of stress that we're placing on our hearts when we're doing the shoveling?
Exactly. People do not seem to realize that snow shoveling is actually a very, very strenuous activity. And if your heart can't take it, you know, bad things, you know, really can happen.
Absolutely. Now, we're looking at some video of somebody shoveling, but we're also seeing people using a snowblower. Is a snowblower any better? Is it still dangerous?
No, snowblower is much better, okay? Although, you know, using a snowblower in itself can be stressful, but it's definitely better to use a snowblower. Or hire somebody. These, some teenage boys come and they knock on your door. They're like, can we shovel your snow?
Right.
And it's not as expensive as you might think. And the truth is, as I was telling, and I tell my patients this all the time, it's better for you to spend, if it's $20, $50, to have someone shovel your snow than to have a heart attack and end up, you know, maimed or worse.
Yeah,
and
take the risk.
Exactly, you know.
Okay, what about exercising, outdoor exercising? You know, a lot of people love to work out outside, and the weather is not going to stop them. Is that bad for our hearts also?
So in some ways, yes. Now, the wind blowing us can, you know, definitely, you know, cause stress on the heart. So I tell people this: during the winter, you have to get creative. If you can't join a health club, for example, when you go grocery shopping, instead of just going and getting your groceries, walk down all the aisles. That'll give you some more exercise.
Okay, keeps you moving.
It keeps you moving. And even simple things like marching on the spot in your house, getting up and dancing during the adverts, doing little exercises help you embrace activity, so you do not necessarily have to go walk outside.
Okay, let's talk about some of the symptoms of heart attacks, because even though we've heard of some of the obvious ones, people still don't recognize them. So tell us, is it different for women than men? We hear that all the time.
Okay. Yes, in some ways. But I always tell people this: it's better for you to go to a doctor and get checked out if you're not sure than to stay at home and have a heart attack.
So what are the symptoms?
Number one, chest pain. Of course, that everyone knows about. Chest pain, it's usually described as crushing. It's described as a pressure that lasts longer than 20 or 30 minutes.
So top 3. So let's get to number 2 then.
Number 2 is I would say, people say they have this feeling of impending doom as well as sweating.
Okay.
The pain can also radiate to the jaw and to the left arm.
Okay, so what would you say the 3rd most common one would be? Or are those the 2 main ones?
Those would be the 2 main ones, yes.
Yeah.
Chest pain, definitely. You always want to have chest pain checked out if you're not sure.
Okay, well, thank you so much for coming in today. Good tips, good advice for us. As I said, we've been very fortunate, and hopefully we won't have to be dealing with too much more snow. Mark Strell standing by to let us know what's the rest.